Hello, my name is Colin Bell, and it's a pleasure to be joining you for the 10th Asian Network Symposium. I'm a professor of public health at the School of Medicine at Deakin University and also co-director of the Global Obesity Centre. I'm presenting today from Warrawarrung Land in Geelong, Australia, and want to start the presentation by acknowledging elders past, present and future, custodians of the land that I'm presenting from. I've had the privilege of working with colleagues from a number of Pacific Island countries over the years, and today I want to talk to you about some of the research we've been doing exploring the regulation of imports of food products to the Pacific. Today I hope to share insights with you on food-related policy implementation and effectiveness in the Pacific, and in particular two countries, Fiji and Tonga, for non-communicable disease prevention. Here is a map showing the locations of the Pacific, 22 Pacific countries and territories, and it includes their exclusive economic zones, and you can see from those that a large focus of Pacific Island economies is fisheries. The two countries that I'll be focusing on are Fiji and Tonga, which are right in the center of the map there. The other thing that's interesting to note about Pacific countries and territories is affiliations for many of them with larger countries like the US and Orange, Australia, New Zealand, or France. The reason our research group is so interested in food-related policy is because of the contribution of diet to chronic diseases and because of the very high burden of chronic disease in many Pacific countries. You can see from this graph chronic disease mortality, and diseases such as heart disease, diabetes and cancers contribute up to 77% of mortality in Pacific countries, and of course there's a really high morbidity rate as well. Here you can see the non-communicable disease profiles for 11 different Pacific countries, and you'll note that the profile varies from country to country, but overall cardiovascular disease is the major contributor to death, and alongside diabetes you are accounting for in excess of 60 and closer to 70% of all deaths. In addition to the health burden that NCDs place on individuals and countries, there's also an economic burden. And that's particularly the case in Pacific countries, as this figure illustrates. What's shown here is the economic burden or economic costs of NCDs as a proportion of gross domestic product, or GDP, and in this case 2010 GDP. And it projects these costs through until 2030 and 2040. There's a few things to note here. Firstly, that at a global level, the average costs of NCDs represent just over 3% of 2010 GDP. For middle-income countries, that's higher. So on average, for middle-income countries, NCDs account for just over 5% of economic costs, but for many Pacific countries, particularly by 2040, you're getting upwards of 10%, and in some cases 15% of GDP will need to be expended on NCDs. Processed foods, and particularly those that are high in fat, high in salt, high in sugar, high in energy or calories, or all of the above, are contributing to this health and economic burden in Pacific countries. For a range of reasons, the foods consumed in Pacific countries are often imported, And you can see in the figure on the left there that of total food expenditure in Samoa, 56% is spent on food imports. That proportion varies from country to country, from as low as 36% in Kiribati to upwards of 80% in Palau. These data were gathered in 2013. You can see from the figure on the right which country those foods are sourced from. The largest sources of food are the USA, Australia, New Zealand, and France. Includes Fiji. Fiji is a country that exports foods to other Pacific countries. And you'll note the wide range of other countries that contribute food exports into the Pacific, including Japan. In an effort to prevent chronic disease in Pacific countries, health leaders have been really proactive at looking at food-related policy as a way of preventing NCD. And we've been involved in Fiji and Tonga with providing policy briefs to the Ministries of Health on various fiscal approaches to preventing unhealthy foods coming into the country and encouraging consumption of healthy foods. And you can see in this table, this one's from Tonga, a range of policy measures that we looked at, from import duties, which are generally levied on goods from foreign countries, to excise duties, which are usually levied on domestic goods. But in the case of the Pacific, they sometimes apply to imported goods as well, because the proportions are so high. To food regulations that protect health and safety more broadly and that are not related to taxes, to price control mechanisms that exist in the country. And in Fiji and Tonga, we provided 30 to 40 of these briefs, and you can see the rationale for each of them here in this case for Tonga. So, for example, to increase the tax on imported products that contain sugar, and the aim there is to reduce sugar intake and therefore reduce the likelihood of diabetes and or heart disease. Of course, foods aren't the only contributors to chronic disease, and you can see that Fiji and Tonga also increased taxes on other products like tobacco and alcohol over the same time. The focus of this presentation, however, is just going to be on diet-related measures. Not all of the policy-related measures that we recommended were picked up, but we were interested in exploring what some of the barriers and facilitators were to those that were picked up. And so we conducted case studies in Tonga and Fiji, covering the period 2010 to 2016, on those policy recommendations that were implemented. We did this by hosting key informant interviews with policymakers. They were in country and in person. This was pre-COVID, and were from a range of government ministries, of course the Ministry of Health, but a range of related ministries, for example the Ministry of Trade or the Ministry of Revenue. And alongside that, we reviewed government documents and peer-reviewed literature for information on the policy implementation process. And in terms of the theoretical background, we drew on Walton Gilson's policy triangle, and there's a picture of that there. We also drew on the work of Kingdon, because we were particularly interested in policy windows, or opportunities where the circumstances are such that it is conducive for policy implementation. We also drew on Sabatier because we were interested in the patterns of interactions between actors, particularly the interactions between different government departments, but also interactions with NGOs or civil society, as well as the food industry. And the type of analysis that we conducted was a manifest content analysis. What were some of the barriers to food policy implementation? In this case, in Fiji. Well, one was a lack of commitment and leadership, a lack of confidence, a small size of the workforce, and a narrow work focus played into that. And you can see some of the quotes related to that on the right-hand side there. For example, the leadership is good there at the ministry, but some leaders are working towards their own ends. What you need is committed people to do it. That was from a government official. Another barrier experienced was that the political environment wasn't conducive to implementing those particular policies, and that may have been due to changing or competing political priorities. Another barrier I've described here is the distance between the policy and the outcome. Sometimes our policymakers reflected that the value of the policy was hard to identify, or that the benefits were not realised until well into the future. And this quote captures some of that sentiment. Nutrition is not like a toothache. You remove the tooth and it goes away. It's there, it's very tangible. You only get to know it after a long term. That's a description of the benefits of the policy, where if they're effective at reducing sugar, for example, that the benefits in terms of reduced diabetes and reduced mortality are a long way into the future and far beyond a typical political cycle, for example. Policymakers, in this case in Tonga, reported that incisive leadership was an important facilitator of policy implementation. They had a vocal champion, and one of them said that it didn't go through the normal process. He used his own line of communication to achieve political intervention, and we see how strong that political intervention was. Another facilitator was good cross-sector collaboration, where policymakers noted that working together sped up the process, and that was fostered by good organisation within the Ministry of Revenue in this case, who facilitated that process by providing good data and organising meetings, etc. And they found that that process and evidence base was also useful for countering industry influence. The quote there is that it has been teamwork, a coordinated effort between the different ministries: health, finance, revenue, customs and labour. No one can do it without the support of the other. We need to remember the partnership, the people and the politicians to work together, and the champions who willingly did it without recognition or need for acknowledgement. We know it is for the best of the country. Another key facilitator of policy implementation in Tonga was awareness and advocacy. There was effort to raise public awareness of the need for the policy, and that was considered to be very supportive. There was great support for this to be implemented, but I must say there's still a lot of work to be done in terms of continuing this fight against NCDs. Another facilitator was the nature, intent and the timing of the policy. There's a quote there that reflects on meat. If meat had been the focus, that it would not have gone through, because that was a popular food product in Tonga and people would have been reluctant to spend more money on it. Eventually there was a tax introduced on meat products. And then in terms of the timing, that last quote captures that. You wouldn't want to do it, introduce new taxes in the year before an election. Most people won't support it because they don't want to pay more tax. And so the food focus of the policy mattered, what the intention was and raising awareness of that, so reducing NCD across the country, and also the timing in relation to the political cycle, all contributed to, as facilitators, to policy implementation in Tonga. Now that we've looked at some of the barriers and facilitators to policy implementation, I want to take a few slides to look at potential policy impacts. One of the policies that was introduced in Fiji was a tax on imported palm oils. And what we did was gather import data from the Fiji Bureau of Statistics and look at how import volumes had changed over time. And we did see a reduction in the import of palm oil from 2012 through to 2015. One of the interesting things policymakers noted in relation to this tax was relabelling by some importers where palm oil was removed from the label and vegetable oil was put there instead, perhaps to try and avoid the tax on the palm oil. Another policy introduced in Fiji was a reduction in the import duty that was placed on imported fruits and vegetables, and this figure shows volume of imported vegetables to Fiji for the year 2010 through to 2014. The red arrow indicates where there was the reduction in the fiscal duty. And the different colours relate to blue for leeks, orange for capsicums, grey for cauliflower, and yellow for celery. And if you look on the right side of the arrow there, it does look like the volumes of these imported vegetables increased over time. We also looked at carrots, which are both imported and grown domestically, and we didn't see as much of an increase in carrot imports over that time. So there was some suggestion that the changes in policy may have been benefiting domestic markets over imports. And what about imports of sugar-sweetened beverages? Here we've got data from 2000 to 2015 for Fiji in the blue and for Tonga in the orange. And the lines there show when new taxes were introduced on sugar-sweetened beverages in both Fiji and Tonga. We didn't observe any reduction in the net weight or kilograms per person of sugar-sweetened beverages imported to Fiji post the 2011 tax introduction, and we didn't have enough data points following the 2013 introduction of the Tonga tax to determine if there were any changes. But there has been a subsequent study by Angela Teng that reported successive tax increases from 2013 in Tonga were associated with increased prices of those products, decreased taxed beverage imports, and increased local bottled water. So it suggested that the taxes introduced in 2013 and a subsequent one in 2016 were having an impact on what people were purchasing. Unless you have a particular interest in trade policy in the Pacific, you probably haven't heard of PACER Plus. So let me briefly introduce you to what PACER Plus is. It provides a framework for trade in the Pacific for countries in and around the Pacific. And as highlighted in the blue there, it's designed as a regional development-centered trade agreement to support Pacific Island countries to become more active partners in and benefit from regional and global trade, as well as to provide commercial benefit to Australian businesses and the other members of the agreement. And you can see the countries listed there, includes several of the Pacific Islands as well as Australia and New Zealand. One of the questions that sits behind our interest in imported foods to the Pacific is who benefits from trade agreements like PACER Plus. It's possible that countries like Australia and New Zealand it's possible that those countries benefit more simply because of the number and volume of goods they have to trade with Pacific countries. With this in mind, we wanted to explore whether imports of sugar-sweetened beverages to Pacific Island countries have increased over time. And to do this, we used UN Comtrade to gather data on the volume and weight of sugar-sweetened beverages imported, the dollar value of those imports, and also the major source countries of those products. The countries involved in this part of the analysis were members of the Pacific Island Forum Secretariat, chosen because of strong ties with Australia and New Zealand. And we gathered population data for some of our calculations, and this was sourced from the Secretariat of the Pacific Community. We used WHO's nutrient profile model for the Western Pacific to determine which products were sugar-sweetened beverages. They use harmonized commodity descriptions and coding systems, the HS codes as they're called, to classify commodities. And that is the same tool that's used to classify the commodities in the UN Comtrade database that we accessed. And we did observe an increase in the volume measured here in kilograms per person of sugar-sweetened beverages to those countries over time, over the 15-year period from 2000 to 2015, from around 10 kilograms per person to 15 kilograms per person in 2015. When we looked at beverage type, it was mostly juices and waters, mineral waters, or aerated drinks, which includes sugar-sweetened beverages that increased over time, rather than milk drinks, for example. And I'll just point out here that the way these beverages are classified, it's not possible to separate out a bottled water, and so that may be contributing to these volumes. We suspect, but don't know, that most of these products are sugar-sweetened beverages, but we can't be certain about that. What we found really interesting was looking at the amount of money countries made selling sugar-sweetened beverages to Pacific Island countries. New Zealand was the top export earner, 260 million, followed by the US, France, and Australia, and Fiji also was a top export earner. They have manufacturing facilities in Fiji and export sugar-sweetened beverages to other countries in the Pacific. In closing then, what can we say about food-related policy implementation in the Pacific? Well, firstly, Pacific countries have identified these policies as a strategy for preventing NCDs, and early data suggests that they are successful. Secondly, development agencies and academic institutions can support these efforts by providing expertise in evidence, modelling data, for example, as well as evaluating the impact of the policies. Thirdly, trade agreements like PACER Plus will favour export countries unless countries like Australia and New Zealand boost their official development assistance to the Pacific. And lastly, the health impact of trade needs to be taken into account more. And I would add to that, the health impact of advertising also needs to be taken into account, so we can avoid circumstances where large food companies like Coca-Cola sponsor major athletic events in Pacific countries, in this case the 2021 secondary school games in Fiji. Thank you for your attention.